formal education within the context of university students' experiences is a place where we think that we can focus on developing this idea of sexual agency. So just to remind you, those three behaviors that I discussed previously constitute sexual agency. We heard from a number of participants who had actually taken credit-bearing courses at the U that talked about sexual violence as a power-based issue, and that those students who have reported those experiences demonstrated some more of those sexual agency behaviors that we talked about. So for that reason, we see great possibility in a structural intervention in integrating more content about sexual violence and consent into courses. Now, in particular, what was interesting to us is we didn't just hear this in students who were talking about having taken classes in gender studies or sexuality studies. We heard it from students who had taken classes in public health, in psychology, in sociology, in English, and even in philosophy. So we see a lot of opportunity here to really understand this as a protective factor. So students who did report having those course experiences also seem to understand some of the power dynamics a little bit more with more acuity than some of the students that hadn't taken any sort of course content. And then there was, as I suggested earlier, this connection to sexual agency. So the initiative that we're suggesting based on this finding is that there's a lot of value in systematically incorporating course content about sexual violence as a power-based issue into these courses that carry credit. These efforts should span disciplines and departments. They should utilize discipline-specific approaches so they don't feel like an add-on or something that's not a core part of that class, but actually using the methods and the approaches of that class. And finally, they definitely should center LGBTQ+ frameworks, narratives, and issues. We see this sort of curricular intervention as a really nice complement to the sexual health curriculum that Carly was mentioning earlier, which would be more of a co-curricular sort of intervention.